Hello, my name is Clint Baylor, and I'm an assistant professor in the Department of Urologic Surgery here at Indiana University. I primarily do prostate cancer, and there's just a huge problem and tension in treating prostate cancer because the nerves for erections run very close to the prostate, and also the muscle for urinary continence is at the apex, or sort of the nose of the prostate. And so there's this constant tension between cancer control and quality of life, this constant challenge to do no harm while we try and treat prostate cancer. 4 to 5 years ago, the Department of Radiology and Imaging Sciences approached us in urology and said, hey, there's a new imaging tracer that almost nobody in the world has. It had been described out of Germany and a few other places, but they said it's called PSMA, and it's an enzyme, it's a receptor that seems fairly specific to prostate cancer cells, and we have the expertise to image this. This was pretty exciting at the outset, but got more and more exciting as we got to meet some of the research scientists. So Dr. Gary Hutchins, Dr. Mark Green, we got to meet some of those on the clinical side doing the research. Dr. James Fletcher, Tamel Turkis, and Dr. Mark Tan and Jordan Swenson, among others. And so this collaboration started, and with a lot of excitement, and after a pilot study, we realized that this PSMA helps us to see things we could never see before. Most of the world was using the imaging and cancer recurrence, but we immediately set up a pilot trial looking at cancer in the primary setting in the prostate, and we noted that PSMA correlated quite strongly with the aggressiveness of the cancer. And immediately we could see and be more confident about the location of the most aggressive components of the prostate cancer within the prostate. And so as a surgeon, this is exactly what we want to know to avoid positive margins or leaving cancer behind. And then it's exactly what we want to know in terms of preserving the tissue around the prostate, what can be saved, what nerve bundles can be saved, what muscles or sphincter can be saved. So it immediately started changing surgical plans, and I saw quality of life improve amongst patients and safely in a way that also limited positive margins. So as a surgeon, as a research scientist, and this was sort of my dream all along, was to be on a research team where all of us collaborated together and we could share in discussing the problem that patients face and how it could be done better. And to be able to have experts on this team from the Department of Radiology and Imaging Sciences is just really makes it fun, because they bring a wealth of knowledge and understanding. I mean, decades of research experience, of grantsmanship. So one of the highlights of my career so far has been this collaboration, and I look forward to a lot of discoveries, and most importantly, bringing patients hope and healing through this collaborative effort.